Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about immunoglobulins, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss indicative repertoire, knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, evidence ideas, and some helpful tips to make candidates' portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the 13th subsection of the second section, demonstration techniques, called immunoglobulins. The portfolio offers indicative repertoire for this subsection that includes kappa, lambda, IgG, IgA, IgM, C3c. The knowledge requirement explains what knowledge is expected of the candidate in relation to the relevant subsection. Candidates should be able to demonstrate their knowledge at the specialist level. Think about what knowledge they had as a Band 5 BMS. How would that differ to the knowledge of a Band 6 BMS? That specialist level of knowledge would allow the candidate to troubleshoot, problem solve, verify or validate. The first knowledge requirement is role of immunoglobulins in immune and inflammatory responses. Candidate needs to have the knowledge and understanding about immunoglobulins. You could ask the candidate to explain what immunoglobulins are, to name roles they play in immune and inflammatory responses. When addressing this knowledge requirement, candidates should consider immune response like antigen neutralization, opsonization, complement system activation, antibody-dependent cell-mediated cytotoxicity, inflammatory response, mast cell and basophil activation, recruitment of inflammatory cells and many other. The second knowledge requirement is key clinical conditions where immunoglobulin demonstration methods may contribute to diagnosis of B-cell proliferations and autoimmune disease. Candidate needs to have the knowledge and understanding about diseases that could be diagnosed by detecting immunoglobulins. You could ask the candidate to name the clinical conditions that can be detected by immunoglobulins, to explain the diagnostic value of those markers, to explain their role in diagnosing B-cell proliferations, to explain their role in autoimmune diseases. When addressing this knowledge requirement, candidates should consider monoclonal gammopathy, detection of M proteins, autoantibodies. What clinical conditions can be detected by using immunoglobulins? Consider oral, skin and renal autoimmune diseases, B-cell proliferations, leukemias, lymphomas, plasmacytoma, or immunodeficiencies. The third knowledge requirement is principles and practice of immunoglobulins demonstration. Candidate needs to have the knowledge and understanding about demonstration of immunoglobulins. You could ask the candidate to list staining methods to visualize immunoglobulins, to explain the principles and practice of those staining methods, to name disease can be detected by those methods, to explain how the positive staining would look like. When addressing this knowledge requirement, candidates should consider the stains highlighted in the indicative repertoire and stains used in their department, the principles of those stains, their methodology, the practical application of those stains, reagents used and why they are used, material, positive staining, associated diseases and so on. The fourth knowledge requirement is relevant antibody validation and verification procedures. Candidate needs to have the knowledge and understanding about antibody validation and verification. You could ask the candidate to name the steps taken during validation and verification, to explain the need for control material, to state the input dilution factor and staining optimization, to explain the role of feedback during verification and validation process, to list the relevant documentation, extension to scope and so on. When addressing this knowledge requirement, candidates should consider tissue type expressing immunoglobulin markers, control material, staining optimization, dilution factor, staining reproducibility, specificity and sensitivity, possible batch variation, pathological significance, pathologist's feedback, relevant documentation, EQA schemes available, extension to scope. The fifth knowledge requirement is review cases and material microscopically for internal quality control and external quality control. Candidate needs to have the knowledge and understanding about microscopic examination of stained slides for IQC and EQA. You could ask the candidate to explain how to assess quality of relevant demonstration methods, to explain the need for controls, how would assessment be done by EQA assessor, to list quality criteria used by EQA schemes, how to record the process. When addressing this knowledge requirement, candidate should consider staining consistency and intensity, specificity of staining, uniformity of staining, presence of ground staining, contamination or deposits, presence of non-specific staining, EQA assessment criteria, control material used, documentation. Competence requirement is basically a combination of knowledge, skills, and experience candidate needs to perform a job to a satisfactory standard. Candidates' chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this subsection. The first competence requirement is follow demonstration method protocols accurately and safely. Candidates should be able to accurately and safely follow demonstration methods. Does the candidate perform relevant demonstration methods safely and accurately? Do they follow relevant protocols and SOPs? Do they use or automated method? Do they know if the demonstration method was followed accurately? When addressing this competence requirement, candidate could consider SOPs, method used, quality control, use of control material, training, competency, importance of following protocols, method reliability, consistency, reproducibility. The second competence requirement is select and use the appropriate control materials, maintaining appropriate audit trail. Candidates should be able to select and use correct control material for demonstration methods and maintain audit trail. Does the candidate use correct control material for relevant demonstration method? Do they maintain correct audit trail for control material used? Do they produce appropriate control material for each demonstration method? When addressing this competence requirement, candidate could consider tissue types, verification, validation process, record keeping, traceability, audit trail, importance of selecting correct control material, consequences of not using correct controls. The third competence requirement is identify stained immunoglobulins present in different tissues. Candidate should be able to identify immunoglobulins on a stained slide. Can the candidate identify immunoglobulins on a stained slide correctly? Do they use correct microscopic technique to identify them? Can they identify the demonstration method used to identify immunoglobulins? When addressing this competence requirement, candidate could consider microscopic examination of stained slides, demonstration method used and the target cells, how the staining would look like on a stained section, their training and competence. The fourth competence requirement is assess stained sections for quality. Candidates should be able to assess quality of stained sections. Does the candidate assess stained section for quality correctly? Do they take correct steps during the assessment? Do they focus on correct features when assessing quality of staining? Maintain appropriate audit trail? When addressing this competence requirement, candidate could consider staining intensity and uniformity, specificity and sensitivity, presence of background, consistency of staining, presence of non-specific staining, staining intensity, EQA assessment criteria, relevant documentation, control material. The fifth competence requirement is resolve any associated problems with the staining methods including root cause analysis, as appropriate. Candidate should be able to troubleshoot staining. Does the candidate resolve problems with staining correctly? Can they identify and solve the common problems? Do they record problems and results accurately? Can they perform root cause analysis? When addressing this competence requirement, candidate could consider investigation, problem identification, corrective actions to fix the issue, preventive actions to minimize problems from reoccurring, possible problems like poor staining intensity, poor specificity of staining, artifact like uneven staining, hazy slides, presence of deposits or precipitate on the slide, reagent contamination, non-specific staining, background, absent staining, cross-reactivity, autofluorescence. The sixth competence requirement is dispose of waste reagents safely. Candidate should be able to safely dispose waste reagents. Does the candidate dispose staining reagents safely? Do they follow local procedures and avoid risks associated with staining reagents? Do they segregate waste as per regulations? When assessing this competence requirement, candidate could consider licensed contractors used by your lab, waste segregation, safety data sheet of reagents that often state disposal ways, risk assessments, local policies, and regulations that are followed, health and safety risks associated with reagents like flammability, corrosivity, environmental toxicity. Each section also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each section. When they complete all the subsections within each section, they will be required to write a reflective statement. They also need to write a personal reflection on their training and why they chose their evidence. To prepare for that, ask them to write a smaller reflective statement for each subsection. What is their role and context of this subsection within the lab? What does their evidence demonstrate? Ask them to write a smaller justification as to why they chose their evidence for this subsection. Also ask them to write about what was their training like when to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier for them at the end of the section. Each subsection also has evidence of achievement. This is a part where you, the training officer, sign the candidate off as competent and fit to practice as a BMS at the specialist level. By doing that, you will confirm that the candidate can work in accordance with local SOPs relevant to this subsection. This will also confirm that candidate has answered questions set by you to test their knowledge and skills relevant to this subsection. And you will also confirm that candidate's chosen evidence demonstrates their competence relevant to this subsection. The candidate will need to be signed off as competent by an internal assessor for each subsection. They can be signed off by you, the training officer, senior BMS overseeing relevant section, or by the training lead. These are some example questions you could give your candidate to test their knowledge and skills about this subsection. These should be based around the knowledge and skill requirements mentioned earlier. These are some more example questions you can ask your candidate to complete, to test their knowledge and skills about this subsection. You could ask the candidate to complete tables you created, based on knowledge requirements. Supporting evidence should be selected by the candidate. It needs to be based around the competency requirements, and be relevant for each subsection. The evidence should allow the candidate to demonstrate their competence in each subsection. It should be specific and relevant to the candidate's in-house practice. It should also demonstrate candidate's specialist competence. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Link will be included in the video description. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if they can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be you, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like case studies, for each subsection. They could use experiments, case studies, annotated results, annotated photographs of them performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose something that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the competence requirements in mind when they are selecting their evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirements for this subsection. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those requirements in mind when selecting questions and guiding the candidate. Bye for now.